so you just finished your cleaning. How was everything?
Good.
Good? Awesome. So I noticed that you have really tight contacts on your teeth, which is good because when you have really tight contacts, the food doesn't actually go really easy between your teeth, so that's a good thing. The only challenge is flossing. So I'll tell you more about that. You also have no recession, which indicates that you don't clench or grind and you don't brush your teeth really hard, so that's good. But the only problem that I noticed is that you have a little bit of a gag reflex when it comes to brushing the backside of your bottom teeth. Do you have a hard time reaching on the tongue side on your bottom teeth?
Mm-hmm.
Okay, so we'll also show you some tips on how to do that. Because the only thing is if you don't brush those areas, you're going to have a lot of buildup, you're going to have a lot of bacteria underneath your gums, and it's not going to be good for the long run. So I'll give you some instructions on how to take care of that as well. And the only other thing is I noticed that you have gingivitis. And you also have some halitosis, which is not good.
What's gingivitis and halitosis?
So gingivitis is actually reversible, so you'll be able to recover from gingivitis. It's an inflammation of the gum, and the way to help it is good oral hygiene. Halitosis is some bad odor coming from your tongue. Your tongue is kind of like a sponge, and it like absorbs all these compounds. There's this thing called BSC, which emits really bad odor. So we'll be able to help you with that as well. I'm going to show you some tools. Do you know how to self-check for oral cancer?
Is that a thing?
Yes, it's a thing. It's a thing. So I'm going to show you as well how to do the head and neck oral screening by yourself at home.
Okay.
It's actually really helpful to do in between your cleanings. So we can monitor that for you as well.
Okay, perfect.
So now I'm going to show you how to do the modified Bass technique, which is the gold standard. So what you're going to need is a soft manual toothbrush. Make sure you get the soft bristle. So what you're gonna do is you're gonna point the bristles at 45 degrees towards the gingiva or the gum line, and you're gonna vibrate and roll. Since our patient is having some trouble brushing on the lower molars on the tongue side, I'm going to show you how to do it. So same thing, you're going to angle your bristles at a 45 degree towards the gum line and vibrate and
Tips for sensitive gag reflex: breathe through the nose, wiggle toes, or do anything to distract yourself. Make a humming sound, place salt on the tip of the tongue, swish salt water or ice cold water if tolerable.
So now I'm going to show you how to do the spool flossing. You're going to grab an arm's length and you're going to wrap it around on one of your middle finger. You're going to wrap the used side on the other middle finger. I'm going to slide it in between the teeth, create a C shape. Drag and do it again on the other side. Drag and then spool it on the other middle finger, wiping up and down on each side of the tooth. So now I'm gonna show you how to floss using a floss holder or floss pick. So it's basically the same thing. We're gonna do the wiping up and down motion on each side of the tooth. And make sure you wipe it with a tissue after every tooth. Although our client has a sensitive gag reflex, we still recommend cleaning the tongue. So we recommend using a tongue scraper instead of a toothbrush for patients with sensitive gag reflex because it has a lower profile. So you're gonna extend your tongue far out. You're gonna grab your scraper and scrape from the back to the front until you remove all of the coating. So for patients with severe gag reflex, I recommend doing it about 5 to 6 times for the first few times you do it. Increase the amount as you get used to it. So for a patient, I'm gonna recommend a Crest Detoxify gum toothpaste. It's really good for people with plaque, gum bleeding, and gingivitis. And it has a foaming action which penetrates deeper into the gum and helps with the gingivitis. So now I'm gonna show you the proper amount to use. So you're gonna grab your toothbrush and just use a pea-size amount.
So for our client, we recommend X Pure OptiRinse Plus. Since our client has high camera, this will be a beneficial mouth rinse. It is antimicrobial, antiviral, and antifungal. It's also anti-caries, so it helps remineralize tooth enamel. It is multi-purpose and alcohol-free. It is also neutral in pH. It is sweetened with xylitol, which is also beneficial. It's also formulated with this substance called Citrox, which is a specific antibacterial bioflavonoid complex. There is no disadvantage to using this product, and it doesn't stain like chlorhexidine does. To use this product, you would rinse once a day with a capful or 10 milliliters for 1 minute, spit it out, and avoid eating or drinking or rinsing for the next 30 minutes. So extraorally, you inspect your head and neck and ears for any asymmetry, any swelling or dry crusty lesions, and any color change. And then you also palpate around your lymph nodes in your neck. So you palpate around your neck using a circular motion with your forefingers, and also around the base of your head. Grab your lips and observe any changes in color, texture, or any lesions. Grab your labial mucosa and pull it down, see if there's any weird color or texture or any swelling, as well as the inside of your cheek. You can palpate around that and examine any lumps or bumps, any color or texture change. You can also look at your gingiva, which is your gums, and examine the palate and just look up and see if there's any discoloration, any lumps or bumps. And you can pull your tongue out and say ah, and observe any changes in size, any ulcerations, coating. Notice the color of your tongue, the texture, And then you can also grasp the tip of your tongue with a gauze if you have any, and gently move it from side to side to examine the borders of your tongue, which is the side of your tongue. And you can also look at the floor of your mouth while you're holding your tongue up, and see if there's any lumps or bumps in there as well. You can feel for it. And that's it for the oral cancer screening.